As the days get shorter and the weather gets colder, many people start to feel a bit down. But could a simple vitamin be the key to boosting your mood during the winter months? Seasonal affective disorder, or SAD, is a type of depression that occurs at a specific time of year, usually in the winter. Symptoms include fatigue, hopelessness, social withdrawal, and more. The role of vitamin D. So what do the studies say? Some studies suggest that vitamin D supplementation may help with seasonal depression, while others show no significant effect. Let's take a closer look. Understanding seasonal depression. This is why light therapy and antidepressants are often recommended as treatments for SAD. Known as winter depression, its symptoms are typically more severe during the winter months, although some people may experience SAD in the summer. Symptoms of SAD can include 1. Persistent low mood. 2. Loss of pleasure or interest in normal activities. 3. Irritability. 4. Feelings of despair, guilt, and worthlessness. 5. Lethargy and daytime sleepiness. 6. Sleeping longer and difficulty waking up. 7. Craving carbohydrates and gaining weight. 8. Difficulty concentrating. 9. Decreased sex drive. For some, these symptoms can be severe and significantly impact daily activities. Spring and summer SAD. Although less common, some people experience SAD in the spring and summer. Symptoms of summer depression may include trouble sleeping, insomnia, poor appetite, weight loss, agitation, and increased irritability. Seasonal changes and bipolar disorder. People with bipolar disorder are at an increased risk of developing SAD. Seasonal changes can trigger episodes of mania or hypomania in the spring and summer, and depression during the fall and winter. Who develops SAD? SAD affects millions of Americans, often beginning in young adulthood, and is more common in women than men. It is more prevalent in northern regions with shorter winter days. People with existing depression or bipolar disorder, especially bipolar II disorder, are more susceptible. SAD can run in families and is more likely if a relative has a mental illness like depression or schizophrenia. Vitamin D and mental health. Vitamin D helps regulate calcium and phosphate in the body, essential for healthy bones, teeth, and muscles. It's also crucial for mental health. Your body creates vitamin D from sunlight, but during the winter months, sunlight exposure is limited, leading to a potential deficiency. Good sources of vitamin D include 1. Oily fish, salmon, sardines, herring, mackerel. 2. Red meat. 3. Liver. 4. Egg yolks. 5. Fortified foods, some fat spreads and breakfast cereals. 6. Supplements. Low levels of vitamin D may contribute to mental health issues like schizophrenia, depression, and SAD. However, while some studies link vitamin D deficiency to depression, they don't prove causation. People with depression may have lower vitamin D levels, but the deficiency might not cause the illness. Research on vitamin D and SAD. We have looked at 10 key papers. These studies suggest that vitamin D may help with seasonal depression by improving mood and reducing depressive symptoms, while other studies indicate no significant effect on mental health scores or depressive symptoms. Let's look at some of the studies in detail. A 2006 study in the Journal of Nutrition, Health and Aging found that vitamin D supplementation in elderly women did not improve mental health scores during the winter months. The study focused on older women aged 70 years or more. It had a sample size of 117 and was carried out in 3 areas of the UK: Herts, Newcastle, York. A study in 2009 by S. Young found that vitamin D may be an effective antidepressant in selected populations with low vitamin D levels and seasonal affective disorder, potentially offering a cost-effective treatment with minimal side effects. This study focused on older adults and healthy participants and had a sample size of 44. A different study in 2012 by Marie Kiergaard, K. Waterloo, C. E. Wang, B. Almas, Y. Fiegenschau, M. Hutchinson, J. Svartberg, R. Jord concluded that low levels of serum 25-OHD are associated with depressive symptoms, but vitamin D supplementation showed no significant effect on depressive symptoms compared to placebo. They used participants with low and high serum 25-OHD levels with a randomized controlled trial of 344. Another study from King's College London, published in 2016, published in the Journal of Affective Disorders, concluded that higher vitamin D levels are associated with fewer depressive symptoms in summer, suggesting vitamin D deficiency may be a consequence rather than a cause of depression. A 2017 study by S. Sarkar found that vitamin D supplementation can effectively treat seasonal depression symptoms by promoting vitamin D synthesis in the skin and promoting a healthy mood and energy levels. Another research paper published in 2022 by T. McCullough, W. Marks, M. Lane, Megan Hockey, A. Loffman, Sana Rajapolvi, Tetiana Rox, A. O'Neill, D. Michulon, Ms. Valkonen Koronen, S. Leto, A. Rusunen found vitamin D supplementation 2000 IU day appears to reduce depressive symptoms in adults, despite high heterogeneity in randomized controlled trials. How to get enough vitamin D? Most people can make enough vitamin D from sunlight from late March to the end of September. During the autumn and winter, getting vitamin D from diet or supplements is recommended. Adults need 10 micrograms, 400 IU of vitamin D daily. Other ways to combat seasonal depression. In addition to vitamin D, treatments for SAD include 1. Getting as much natural sunlight as possible. 2. Regular exercise. 3. Managing stress. 4. Light therapy. 5. Cognitive behavioral therapy, CBT, or counseling. 6. Antidepressants like SSRIs. Conclusion. Vitamin D plays a crucial role in overall health and may help manage symptoms of seasonal affective disorder, SAD. Research on its effectiveness for treating SAD is mixed. Some studies show benefits while others do not. Nevertheless, maintaining adequate vitamin D levels is important. If you experience symptoms of SAD, consult with a healthcare provider to explore various treatment options, including light therapy, exercise, and cognitive behavioral therapy. Understanding and addressing SAD can significantly enhance your quality of life during the affected months.